Hi, my name is Misty Tillman, and I chose to do my informative speech on medulloblastoma. The reason I chose medulloblastoma is I happen to be following a little girl here in Topeka who was diagnosed with this on Facebook, and I found it to be very interesting and wanted to provide some factual information for you guys. So here it goes. So what is a medulloblastoma? Well, a medulloblastoma is a malignant brain cancer that arises from the cerebellum. That's the part of the brain that controls balance, coordination, and other complex functions. Medulloblastoma is believed to arise from fetal cells that remain in the brain after birth. These kinds of tumors arise in the posterior fossa region of the brain. They're also referred to as primitive neuroectodermal tumors. This particular type of tumor has a tendency to spread to other areas of the brain and the spinal cord. There are approximately 500 cases that are diagnosed each year, and most of them are diagnosed before the age of 10, according to the University of Texas. This particular disease is more common in boys than girls, but it can affect both sexes. It accounts for about 20% of diagnosed childhood brain tumors, according to St. Jude. Before being diagnosed with such a malicious, aggressive cancer, one would experience symptoms similar to influenza. They might experience headaches, nausea, vomiting. Clumsiness and seizures are also other symptoms that could occur periodically. The first symptoms of any brain tumor are usually due to increased pressure within the skull, the raised intracranial pressure. This may be caused by a blockage in the ventricles, which is the fluid-filled space in the brain. That leads to a buildup of CSF, also known as cerebrospinal fluid. The increased pressure can also be caused by its swelling around the tumor itself. So we kind of talked about what medulloblastoma is, but how many are there? Well, there's several types. One particular type is the classic medulloblastoma. You also have the desmoplastic nodular medulloblastoma, large cell or anaplastic medulloblastoma, medulloblastoma with neuroblastic or neuronal differentiation, medulloblastoma with glial differentiation, medullomyoblastoma, which has to do with the muscles, and melanotic medulloblastoma. All medulloblastomas are located in the cerebellum, which is located in the lower rear portion of the brain. They rarely spread beyond the brain and the spinal cord, and like many tumor types, the exact cause of medulloblastoma is not known at this time. This debilitating cancer does have several types of treatments. Once it is diagnosed by either an MRI or a CT scan, most physicians will begin treating it immediately. When treatment is done without delay, most generally the prognosis has a positive outcome. The treatment of the medulloblastoma depends on a number of factors, including your child's general health and the size and the position of the tumor itself. Most commonly, a course of action is recommended by what they call the MDT, or the multidisciplinary team. That team consists of neurosurgeons, neurologists, oncologists, and other healthcare professionals such as a dietitian. Most medulloblastomas, like most cancers, are treated with chemotherapy, radiation, and surgery. Unfortunately, there are many side effects that come with these types of treatments. Posterior fossa mutism is a condition that may occur after surgery. Within 24 hours, the child develops the inability to speak, has problems with balance, and has difficulty swallowing. This condition may range from mild to severe, according to Boston's Children's Hospital. Radiation and chemotherapy treatment can be very beneficial, but they can also damage the healthy tissues. As a result, your child may experience long-time side effects after treatment, such as hearing loss or loss of height, endocrine dysfunction, which is hormonal problems, secondary tumors, secondary leukemias. It's not really the best thing to be diagnosed with as a child. Childhood is supposed to be about having fun and playing with your friends and going to the playground and parks and things like that. How well a patient responds to treatment is affected by the age they are at the time of diagnosis, the size and the extent of the tumor, and the amount of mass that can be removed safely, and the level of metastatic disease. Prognosis for survival is between 60 and 80% according to St. Jude's. With aggressive treatment, most children can be cured of this monster. However, for patients 3-year-olds or greater with average risk disease, that is defined as complete removal of the tumor or no signs of the tumor spreading to other parts of the central nervous system and body. Those patients are treated with a combination of complete surgical removal of the tumor, radiation, and chemotherapy, and over 80% can be cured completely. Patients that are younger or have high-risk medulloblastoma have a lesser chance of survival due to the fact that physicians cannot treat them as aggressively as they treat the other patients. In conclusion, like I said, I had the opportunity to meet a young lady here in Topeka, a beautiful little girl that's in my hometown that was diagnosed with this cruel cancer in fall of 2012. I've been following her story ever since I have the privilege to meet her and her family, and she is just a ball of joy, and this is not tearing her down at all. She has the brightest outlook on life and is just truly inspiring. And she's had surgery and ongoing chemotherapy and radiation treatments. And I can only pray that she is in that 60 to 80% of those who survive. She inspires me with her strength, her courage, and positive outlook. And may God bless her and her family. I hope you enjoyed my speech, and thank you very much.